If you're living with pain from a spine problem, you're not alone. Right now, more than 4 million people in the United States are suffering with pain from spine problems. Many of these people believe that their only surgical option is open back surgery. Since open back surgery is a very painful and highly invasive procedure that works less than half the time, many of these people in pain have lost hope. This is the world-famous Bonati Institute. The Bonati Institute has restored hope for thousands with its advanced, specially developed surgical procedures. The Bonati procedures have virtually eliminated the need for open back surgery. It was here that the techniques, the technology, and the patented instrumentation that would take spinal surgery to the next level were developed. Since then, the Bonati Institute has become a world destination for people with chronic pain, looking to regain their hope. A key to the uniqueness and effectiveness of the Bonati procedures is the Bonati Institute's extensive analysis and diagnosis of the patient's MRI film prior to surgery. MRI scans allow the Bonati Institute's surgeons to view the spine and surrounding soft tissue in three-dimensional precise detail. The Bonati Institute's nerve pathway analysis is then used to trace the pain back to its exact source. Once the source of pain is determined, a complete diagnostic workup follows, including physical assessment tests and nerve conduction tests to isolate any abnormalities of the nerves, spine, or soft tissue. This careful and thorough analysis and diagnosis allows the surgeon to isolate the exact source of the pain and to treat that pain with minimal disruption to the surrounding muscles and tissues. The Bonati procedures use the smallest incision possible, usually less than a ½ inch in length. This micro-incision allows for minimal disruption to the body, minimal blood loss, less scarring, faster healing, less chance of infection or complications, and a much shorter recovery period. In fact, the Bonati procedures require only local anesthesia and qualify as outpatient surgeries that do not require costly overnight hospitalization. And as outpatient surgeries, the Bonati procedures allow the patient to begin physical therapy immediately and return to daily life in a matter of days. The surgical center's 3 fully equipped operating rooms are state-of-the-art and staffed with a medical team experienced in nearly 25,000 successful procedures. This is an unparalleled record of success in providing relief from pain for numerous back and neck conditions, including herniated discs, spinal stenosis, degenerative disc disease, sciatica, nerve compression, spondylolisthesis, foraminal narrowing, and even previous failed open back surgery. Consistently, more than 90% of the Bonati Institute's patients report immediate resolution of their pain following a Bonati procedure. Since discomfort following surgery is minimal, patients are encouraged to begin walking immediately after surgery. Pain management and physical therapy at the Bonati Institute avoid the use of narcotics in favor of aquatic therapy, massage, and biomechanic and posture training. Every day, thousands of people looking for an answer to pain from spine problems are told that there's nothing that can be done for the pain and they just have to live with it. Yet, there is an answer, and it can be found here in the Bonati Institute's advanced spinal surgery. Are you living with chronic pain from a lumbar or cervical spine problem? Have you been told that you just have to live with your pain? And are you finding that you just can't? The Bonati Institute near Tampa, Florida can restore your hope even if you've had previous spine surgery that failed. The Bonati procedures are over 90% successful in ending pain from lumbar and cervical spine problems. So you can get back to living and loving it.